1. Which of the following permanent teeth is most likely to exhibit a bifurcated root? A. Maxillary central incisor. B. Mandibular canine. C. Maxillary first premolar. D. Mandibular second premolar. 2. What is the primary function of the periodontal ligament? A. To initiate tooth development. B. To attach gingiva to the tooth. C. To anchor the tooth to the alveolar bone. D. To prevent pulp necrosis. 3. Which bacteria is most commonly associated with dental caries in enamel? A. Porphyromonas gingivalis. B. Streptococcus mutans. C. Actinomyces viscosus. D. Lactobacillus acidophilus. 4. In endodontic therapy, sodium hypochlorite is used primarily for A. Lubrication of canals. B. Sealing of root apices. C. Disinfection and tissue dissolution. D. Obturation. 5. Which type of collagen is most abundant in the dentin matrix? A. Type 1, B. Type 2. C. Type 3. D. Type 4. 6. Which vitamin is essential for collagen synthesis in the oral cavity? A. Vitamin A, B. Vitamin B12. C. Vitamin C, D. Vitamin D7. Which of the following is a characteristic of amelogenesis imperfecta? A. Hypercementosis. B. Delayed eruption. C. Enamel hypoplasia. D. Macroglossia. 8. In epidemiological terms, the DMFT index measures A. Dental plaque accumulation. B. Tooth mobility. C. Caries experience. D. Periodontal depth. 9. What is the most appropriate radiograph for evaluating an impacted third molar? A. Bite wing. B. Periapical. C. Occlusal. D. Panoramic. 10. Which nerve provides sensory innervation to the maxillary teeth? A. Inferior alveolar nerve. B. Greater palatine nerve. C. Buccal nerve. D. Posterior superior alveolar nerve. 11. The primary cause of dental fluorosis is A. Excessive fluoride exposure during enamel formation. B. Inadequate brushing technique. C. Vitamin D deficiency. D. Genetic mutation of amyloblasts. 12. Which of the following best describes an epulis fissuratum? A. A reactive lesion from ill-fitting dentures. B. A congenital swelling on the palate. C. A cyst from non-vital teeth. D. A salivary gland tumor. 13. A patient presents with punched-out interdental papillae, fetid odor, and pain. What is the most likely diagnosis? A. Chronic gingivitis. B. Acute necrotizing ulcerative gingivitis. C. Periodontal abscess. D. Pericoronitis. 14. In prosthodontics, a Kennedy Class 1 arch refers to A. A bilaterally dentulous area posterior to remaining teeth. B. A unilaterally dentulous area with teeth posterior to it. C. A singly dentulous area not crossing the midline. D. A bilaterally dentulous area with anterior teeth missing. 15. Which material is considered best for direct pulp capping? A. Amalgam. B. Glass ionomer. C. Zinc phosphate cement. D. Calcium hydroxide. 16. The primary advantage of using a light-cured composite resin over a chemically cured one is A. Lower cost. B. Improved radiopacity. C. Longer working time. D. Decreased polymerization shrinkage. 17. A tooth with a large carious lesion tests non-vital and is asymptomatic. What is the best treatment? A. Indirect pulp cap. B. Root canal therapy. C. Extraction. D. Direct pulp cap. 18. Which condition is associated with a ground glass radiographic appearance of the jaw? A. Osteosarcoma. B. Paget's disease. C. Fibrous dysplasia. D. Osteomyelitis. 19. What is the most significant contributor to early childhood caries? A. Milk during meals. B. Frequent consumption of sugar-laden beverages. C. Fluoride deficiency. D. Brushing only once per day. 20. Which of the following is a contraindication to the use of an epinephrine-containing local anesthetic? A. Controlled asthma. B. Hypertension managed by medication. C. Recent myocardial infarction. D. Type 2 diabetes. 21. Which muscle is primarily responsible for opening the mouth? A. Masseter. B. Temporalis. C. Lateral pterygoid. D. Medial pterygoid. 22. A 10-year-old child presents with bilateral posterior crossbite. What is the best initial treatment approach? A. Extraction of primary canines. B. Orthognathic surgery. C. Rapid maxillary expansion. D. Night guard therapy. 23. What is the most common malignancy found in the oral cavity? A. Basal cell carcinoma. B. Kaposi sarcoma. C. Squamous cell carcinoma. D. Adenocarcinoma. 24. The function of the Golgi apparatus in ameloblasts includes A. ATP production. B. Enamel matrix protein secretion. C. DNA synthesis. D. Odontoblast differentiation. 25. Which of the following best describes the concept of biologic width? A. The space from the gingival margin to the CEJ. B. The sulcus depth plus epithelial attachment. C. The combined epithelial and connective tissue attachment. D. The distance from bone to occlusal surface. Assessment of fundamental knowledge. The Assessment of Fundamental Knowledge, or AFK, is a standardized examination administered by the National Dental Examining Board of Canada, or NDEB, for internationally trained dentists seeking certification to practice in Canada. This exam evaluates a candidate's understanding of basic biomedical and clinical sciences as taught in Canadian dental programs. It is typically one of the first steps in the equivalency process and consists of multiple-choice questions that assess knowledge in areas such as anatomy, physiology, pathology, microbiology, pharmacology, and general dentistry principles. The AFK ensures that candidates possess a strong foundational knowledge necessary to proceed to the next stages of certification and ultimately provide safe and competent dental care within the Canadian healthcare system. Here are the top 5 beneficial uses of the AFK exam. 1. Entry point for certification. The AFK is the first mandatory step in the NDEB equivalency process, enabling internationally trained dentists to begin the path toward Canadian licensure. 2. Knowledge assessment. It allows candidates to evaluate their understanding of fundamental biomedical and clinical sciences, identifying areas for improvement. 3. Academic readiness. A strong AFK score demonstrates readiness for advanced assessments like the ACJ or ACS, boosting confidence and preparedness for the next stages. 4. Credential recognition. The AFK helps validate international education by aligning it with Canadian dental standards, supporting fair credential evaluation. 5. Career advancement. Passing the AFK opens pathways to clinical practice, specialty training, or academic roles in Canada's dental healthcare system.